Mr. Bonin.
Thank you, Mr. President. Thank you for calling on me, but also thank you for introducing this legislation and for being an advocate for this. And I want to thank everybody who came down here today. Thank you for your advocacy here at the city level, but across the country. But more importantly, thank you for the personal stories you told and the human face that you put on the situation. We heard some really wrenching stories about the horrible consequences and the horrible choices that people are facing and living with as a result of our current policy. Now, some people get concerned when we talk about something that is a piece of federal legislation. They say it's not local. I'd say there's nothing more local than this. These are our people who are getting sick. These are our people who are making a choice between sending their kids to school or paying a prescription or buying a meal. And we fight all the time here on behalf of legislation that would help people with public housing. We're fighting the administration's efforts to evict 55,000 people from public housing here in Los Angeles because they would become homeless here in Los Angeles. We fight all the time for more infrastructure funding from Washington because it would provide more mass transit here in Los Angeles for the people who live here. We fight for better environmental standards because it affects the air quality here in Los Angeles. And as Maureen Cruz so well pointed out, Medicare for all would actually save the city money. We would be paying significantly less in overhead for Medicare than we would be the untold millions we pay in overhead for corporate, private, for-profit insurance. And that means we have more money here to spend on our parks or on our streets or hiring more firefighters or addressing homelessness. Now, the administration, what's happening in Washington now, I often refer to as a continued war on children. There's a study that just came out from Georgetown University the other day that pointed out that over the past 2 years, 400,000 children have lost their health care coverage, nearly 500,000 children. That's because of efforts to repeal the Affordable Care Act and Medicare, because of delays in funding for the Children's Health Insurance Plan, because of the effective elimination of the individual mandate, and cuts to the Affordable Care Act enrollment, outreach, and advertising. Almost 500,000 children. That's door number one, what we have now. Door number two is Medicare for all. And one of the other speakers passed out these cards for all of us, explaining what Medicare for all would mean. Network, all providers included. Copays, primary care, 0. Specialist, 0. Mental health, 0. Dental, 0. Vision, 0. Hospital, 0. Is prescriptions covered? Yes. Eyeglasses covered? Yes. Hearing aids covered? Yes. Long-term care? Yes. What's the deductible? 0. What's the monthly premium? 0. This is the right thing to do for the nation. It's the right thing to do for Los Angeles. Thank you, Mr. President.